All right, the last lab video. As promised, I'd get this out to you guys tonight. Um, so yeah, we're just gonna get right into the lab and go over some of this info that you'll need for all these questions. Starting with A, Freya's story. I'm not gonna read the whole question just like last time because you guys have it in front of you. I'll just say what number I'm on. So this one's A. It's the tragic story about my healthy, beautiful 19-month-old daughter Freya was taken from us. Pretty much this one just goes over she had a really high temperature. um, she eventually lost brain function. She had brain damage, and it was a very fast progression. Um, she got really drowsy. So the parent pretty much knew something was wrong, and when they got to the hospital, and it ended up being too late. Pretty much, she had widespread brain damage within a day or two, and she eventually had to be put in children's hospice, and they had to pull the ventilator, and then she ended up dying. And with the quick progression of this fever to loss of brain function, you're automatically going to be thinking bacterial meningitis, and that's what this is. Not viral, because like most things, viral infections are far less severe than bacterial infections, and bacterial meningitis can be caused by Neisseria meningitidis, strep pneumo, um, Haemophilus influenzae. But in this case, I think it was meningitis B, which you can be vaccinated for, but the kid wasn't vaccinated, and that's why she got this, and it ended up leading to her death. So A is bacterial meningitis. All right, the second one is about the 66-year-old man who is going on an RV trip to Phoenix, Arizona. And he comes down with these symptoms of severe headache, severe neck stiffness, um, and he has no bacterial organisms in his blood. The spinal tap did reveal large cell morphologies. So if it's not a bacteria and it's a large cell, you're thinking fungus right away. And with this one, it's located in the southwest United States, so you're going to be thinking Coccidites immitis, or C. immitis. That's a fungus found mostly in the southwest United States, desert areas, and when he went there, he ended up coming down with it. So, yeah, the southwest United States, non-bacterial meningitis symptoms lead to fungal meningitis, most likely caused by C. immitis. All right, C, the 7-year-old guy from Illinois, complaining of fever, nausea, vomiting, headache, confusion, disorientation, and muscle weakness. Um, he has no recent travel of the outdoor area, but there's an endemic of dead crows that has been recently reported in the county. So, um, for this one, you're thinking viral encephalitis. Your flu symptoms and your headache and disorientation. But in the slides, there's a slide that says some viruses that may cause encephalitis have an unintentional host of dead birds. So with this, the dead crows thing, yeah, it's viral encephalitis, pretty much. That could be SLE, West Nile virus, lacrosse / California encephalitis, WE and E. Those are all ones you have to differentiate. This is not something I really remember being of great detail, like the viral encephalitis is on the test. But for sure, definitely go over it. But yeah, this dead birds thing, he wouldn't say that for no reason. Oh yeah, this guy has all these symptoms, but yeah, there's been dead birds in the area. No, there's a reason, because in his slides he puts that information on viral encephalitis. Yeah, so C, viral encephalitis. All right, for D, I'll keep it simple. It's the 28-year-old female, rushed to labor. Um, it's a complicated labor that she has when she's delivering her baby. Premature infant born with low birth rate, malformities in limb development, conjunctivitis, cataracts. All these are just saying that what he wants you to put is these are teratogenic effects, and those could be caused by a number of diseases such as rubella, toxoplasmosis, herpes. The issue might be caused by chlamydia or gonorrhea. So all these are just teratogenic effects. All right, so now we're on E. It's a 72-year-old man who complains of diarrhea. And so he's given medicine, told go home, take it, and come back in 3 to 5 days if it's not better. Um, the next day he's unresponsive, weakness, or non-responsiveness, weakness, lethargy, and stuff like that. So here you're going to be thinking listeria for the reason that you have the diarrhea plus the neurological symptoms. This is like a foodborne pathogen, so it might have been something he ate, but for people who are older, it can lead to a meningitis. And this guy is 72 years old, so he fits the script. He had the diarrhea, then the neurological symptoms, and yeah, so this one is listeria. All right, so this one is F, the one about the 3-day-old infant. When the nurse picks her up, they notice she was really hot. Rectal temperature showed she had a concerningly high and sudden fever. So this is neonatal meningitis, most likely caused by E. coli or Group B strep, which is part of the vaginal normal flora, and this is a lot of the time passed between the mother and the baby when the baby is being birthed vaginally. So this baby most likely has gotten it from her mother's normal flora, and yeah, so she has neonatal meningitis. All right, this next one, H it is. Several children in a kindergarten class have a dark, angry red rash, some spots in their oral mucosa. So these are called Koplik spots. And if they have an angry red rash with oral spots, you're automatically going to think measles, straight up. So yeah, measles. When you have measles, you risk, like he goes over or went over a long time ago. Actually, when you guys went over skin stuff, that you have a risk of like 1 in 1,000 without the MMR vaccine of your brain swelling and causing encephalitis. But if you get it, you have like a 1 in a million chance of that happening. So there is a pro to getting the MMR vaccine. It prevents measles, or helps prevent measles, and you lower the risk of life-threatening encephalitis. But yeah, so the Koplik spots in the oral mucosa and the angry rash is measles. All right, we'll go on to I. It's a 22-year-old female, semi-conscious. She breaks up with her significant other over a newly diagnosed STI. She developed signs and symptoms on her lips that she related to the STI. So this is herpes virus encephalitis. She notes that her significant other had an STI, and now she's semi-conscious. So, and the signs and symptoms on her lips, the lesions could, or in this case, it is herpes, and herpes can lead to encephalitis. So yeah, herpes encephalitis is I. All right, since J through O are supposed to be like on the iPads that we have in lab, which obviously you don't, we're gonna go to P. So this one is just about the cast of Breaking Bad all developing a respiratory illness while they were filming in Arizona. And as we said earlier, this is caused by C. immitis, and it's called San Joaquin Valley fever. But it asked, describe the epidemiology for the case. And in this case, it's called an endemic, so it's like a pretty localized thing. It's not like a pandemic or an epidemic. It's an endemic. It's like this is in the Southwest, so it's not spreading across the whole country. It's specific to a place, and that's called an endemic. Yeah. So yeah, endemic, San Joaquin Valley fever caused by C. immitis. That's it. All right, so this next one has to do with the flu vaccine. Describe how it offers protection. Describe the spread and symptomology of influenza. Describe the epidemiology they were trying to protect against. So the vaccine offers protection by when you're exposed to the vaccine, your body creates memory, like by B cells producing antibodies so that you have protection when you're exposed to the actual virus. The spread and symptomology, respiratory droplets, just like this coronavirus. People cough on you, it sits in the air, breathe it in. People sneeze and it gets in your eyes, your nose, your mouth. Symptomology, a lot of you probably had the flu. So, your fever, your cough, the dry cough, the super high fever. You feel like crap for a few days, then it goes away usually. Epidemiology that we're trying to protect. A lot of people travel, and a lot of people can be subclinical, which means like they have very mild symptoms or no symptoms at all. So, older people are always at risk for infections like this. So we're trying to prevent this from becoming a large epidemic by having flu vaccines or a pandemic for that matter, and trying to protect our older population. So yeah, flu blossoms um, every season pretty much from October to March, and as people travel, it gets to more people. So having the vaccine, um, making more people immune to this seasonal flu really helps and helps prevent the spread to older populations. So R is about the patient that arrives at the ER, and it says describe the process reactions flow through that would go into this kind of identification of an organism. So pretty much what I want here is just you're taking a sample of blood, isolating the DNA, and the DNA is then used for PCR reactions. PCR allows us to identify organisms that we're looking for. For every organism has a specific PCR reaction. So once you get that PCR reaction and you identify that PCR reaction, like you'll know exactly what organism you have. So yeah, extract the DNA, use it for PCR, and then it'll take about 3 or 4 days until you have a definite answer on what organism this is. All right, so S is the one about C. diff, diarrhea, and pretty much that this patient was given antibiotics that would kill C. diff, but they didn't work. Why would that be? Well, plasmid conjunction might be a reason. So what that is like free floating DNA in bacteria can be transmitted to each other. So like this C. diff bacteria might have picked up a piece of DNA from another bacteria that is resistant to that antibiotic that kills C. diff. So by C. diff picking up different pieces of genetic information from other bacteria in your body, it can become resistant to antibiotics that usually work. So yeah, plasmid conjunction, passing antibiotic resistance genes is what I'm looking for. So this one's T about the unknown infection, or unknown organism infecting babies was traced to consuming contaminated powdered infant formula. It goes on to say like this isn't a sterile product and organism was unusually resistant to drying. So and then it asks like what is R-flip used for and how it works and what might it be used for. So this says isolate DNA from the source and organisms to compare it to. So you're just pretty much like isolating DNA of different organisms and then comparing it to the organism that you're testing for. So like you isolate the DNA of the organism that you have that causes a disease, even though you might not know what it is, and then compare it to other organisms that you have known. And once you compare those, you can pretty much see like what you got. So yeah, so isolate DNA from the source and organisms to compare it to. So yeah, isolate the DNA, compare it to other organisms. All right, so now we're on to U. This one's discuss the general approaches to evaluating, doing a physical exam and health history, and educating a patient with suspected respiratory disease, showing basic respiratory symptoms, BRS. How does our discussion from epidemiology come into play here? What basic respiratory symptoms are not concerning, and what BRS are exaggerated by patients? What BRS constitute as emergency? So you guys have talked about like the incubation, the prodromal, and invasion and convalescent stages of a disease, and why people avoid patients with heavy symptoms but catch it from. But they actually like people tend to avoid others with like the heavy symptoms, like you're very sick or something. But if somebody has like a stuffy nose and there's a slight cough, people tend to be like, oh, you might be getting sick. Like you continue to hang out with them or be around them. But a lot of people don't realize that's when you're contagious a lot of the time. So about these basic respiratory symptoms, you should start asking questions about when their symptoms started, who else has it, what have they taken for it, and like what unique symptoms they might be experiencing. For like the questions asking about what BRS are exaggerated by patients, so a lot of times fever can be exaggerated. Pain and some uncomfort can be exaggerated by people because some people have a lot less tolerance for some little pain that they might explain as pretty severe. like runny nose and cough usually aren't too exaggerated because you can really tell like if somebody nose is running, if somebody has a really bad cough, but you can't really tell if like somebody, you know, has like a little bit of pain and they're like, oh my God, this is a 10 out of 10. But it's probably not. So, pain a lot of the time is uncomfortableness is exaggerated, but so lung sounds and O2 stats. So like if you have really really O2 like low O2 with respiratory symptoms, that is a emergency. So for the ones that ask which ones are exaggerated, pain and uncomfortableness is a lot of the time exaggerated. Um, Emergency can be, lung sounds, cough, and O2 stats. All right, now into the more easy ones. So, an 18-year-old college student is seen at the student health center. Sore throat, cough 3 days. Exam shows a normal appearing male patient. So, I mean, these pretty minor symptoms came and went pretty fast. It's your normal common cold. Your rhinovirus is most likely the cause. Rhinovirus is most likely causing most of your common colds that you'll get. So yeah, rhinovirus, common cold, it's V. All right, W is about the 5-year-old boy who goes to the doctor with a red throat and a decently high fever. This one is pretty simple. It's just pharyngitis. Pharyngitis can be caused by a lot of things. S. pyogenes, F. necrophorum. It could be viral, like rhinovirus or something like that. Group A strep, stuff like that. So there's a couple different kinds of pharyngitises that you should look over in the slides. But yeah, this one pretty basic. It's not very complicated. Yeah, it's just pharyngitis. All right, so X is just this 23-month-old toddler going to her pediatric clinic, citing irritability, low-grade fever, sniffles, twisting the head and neck. So the exam shows red erythematous tissue with fading landmarks. So they did tympanic membrane examination, which is in your ear. Fluid is noted, so it's acute otitis media. The best thing for this is just like watchful waiting. If it's an ear infection, usually things will clear up within 72 hours, but it could get worse. So if it's not better in 72 hours, concerns could be like your tympanic membrane rupturing or your eardrum rupturing. That's the tympanic membrane, or meningitis. So watchful waiting at first, but yeah, if it stays bad, go back to your doctor. All right, so Z is just the one about the bunch of family members coming into your clinic with a sore throat and stuff like that. Basically, they all obviously have a respiratory illness, but it could be a lot of things because it's not very specific. It says the kids are coughing more and having more severe symptoms. So there's a lot of things that you could be looking for. If you're looking for RSV, then you could notice some pneumonia-like symptoms and cyanosis for sure. So that's like a blue tint in the face or the lips and stuff like that to let you know that there's a lack of oxygen. So RSV is a possibility. Pertussis, which is that whooping cough, and it's usually uncontrollable. It's violent. Violent whooping cough. That could be pertussis, or diphtheria. Like if they had diphtheria, it says they're from another country, so that might be prevalent in a different country. Diphtheria is most commonly noted by your rapid strep test, and if there's like pseudomembranes, so like that growth, which seems like in the back of your throat, could indicate diphtheria. So RSVs are a possibility, pertussis is a possibility, and diphtheria is a possibility. All right, so these next few are pretty simple. We'll just start with AA. It's about the 15-year-old boy. But I'm not going to read the symptoms because you guys have it in front of you. But just know this one is walking pneumonia caused by Mycoplasma pneumoniae or Chlamydia pneumoniae. Both are gram-negative. BB is a 66-year-old woman with chronic lung disease. She's in the hospital, and then she gets a pneumonia. So this is opportunistic pneumonia. It's nosocomial. Nosocomial means you get it while you're in the hospital. This is likely Pseudomonas, but there's many other causes, or like there's many other organisms that could cause opportunistic pneumonia in the hospital. The next one, CC, is a 33-year-old seen by his nurse practitioner with shortness of breath. He has AIDS. And yeah, so yeah, this one is PCP, pneumocystitis or gyrovici. So this is a fungal pneumonia that is most common and almost always seen in people. Like this disease is almost only found in people who have HIV. So it's an HIV defining illness, a pneumonia, because your immune system is compromised. So this allows this fungus to get in your system and cause a pneumonia. So yeah, pneumocystitis gyrovici. DD is a 28-year-old woman who has fever, night sweats, coughing up blood. So right there, coughing up blood, fever, night sweats. You should most likely be concerned with tuberculosis, and that's what this is. Tuberculosis caused by Mycobacterium tuberculosis, or MAC. Yeah. So the next one, EE. A 7-year-old woman with history of CHF is seen in January by her primary care nurse with an abrupt onset of fever, cough, myalgia that requires hospitalization. She experiences a cough and shortness of breath. So this is a influenza, which is most likely developed into a second degree pneumonia. So like influenza that has eventually like progressed into pneumonia is what I'm trying to say. So influenza virus, yeah, like the fever, the cough. Her cough keeps on getting worse and worse and worse. It says over the next few days. So fever to pneumonia is that one. Yeah, and we'll stop there for EE. All right, so FF, the 6-year-old who's in respiratory distress. Examination shows wheezing and mild cyanosis. So this is bronchitis and lower respiratory disease, most likely respiratory syncytial virus. Because of the cyanosis, cyanosis is not like limited to respiratory syncytial virus, but if you notice, like cyanosis or bluing color on the exam, it's probably RSV. So GG. 65-year-old woman taken to the ER by her daughter. She has cold-like symptoms for the past couple of days. Fever spiked to 102. She's experiencing chills, pain in her chest, productive cough with trace of blood. Gram-stained sputum reveals a large number of diplococci. So this is community-acquired pneumonia. Most likely caused by Streptococcus pneumoniae. This is a capsule. So S. pneumo is the cause. Community-acquired pneumonia caused by strep pneumo. Sorry, making that confusing. So HH. We can't do HH because we don't have the iPads, and we can't do II because we don't have the iPads either. So we'll go to JJ now. JJ looks like a duplicate, and we went over that one earlier. It's pharyngitis. KK is mononucleosis caused by EBV for the fact that, sore throat with pharyngitis, cervical and axillary lymphadenopathy, so swollen lymph nodes in your neck and your armpits, and splenomegaly, so swollen spleen, and those are all symptoms of mono caused by Epstein-Barr virus. So LL is Rocky Mountain Spotted Fever caused by Rickettsia rickettsiae. You notice this because of the rash movement from the extremities to the center. This is caused by a tick bite, but it's different than like something like Lyme disease, because with Lyme disease you'll see this bullseye rash, and it's like a dot, and then it's like a big old red circle around it. With this, you don't have it; it's just a rash moving inward. So that's Rocky Mountain Spotted Fever. Highlighted by the fever, the severe headache, muscle aches, and the rash on the body. The next one, MM, 48-year-old man, Arkansas, seen by his physician for ulcerated lesions on his finger, and then his lymph nodes are enlarged and painful, fever and headache. So this is tularemia. It is a tick-borne illness. It resides in rodents like rabbits and stuff like that, and he has a history of dressing these animals, and he is from Arkansas, and tularemia is an endemic specific to Missouri and Arkansas. So with the history of being in Missouri and dealing with rodents and these symptoms, you can pretty much determine that he has tularemia. Next one, it's a 55-year-old guy from Sudan. Sudden onset of fever, muscle pain, headache, followed by intense weakness and vomiting and diarrhea. His condition deteriorated quickly after he went to the hospital. His post-mortem autopsy, so after he died, they did an autopsy showing internal organ hemorrhaging. So stop right there when you see hemorrhaging. You're gonna think Ebola. You're gonna think Ebola virus. Ebola virus isn't always hemorrhagic, like that outbreak that pandemic that we had a few years ago, 2015-ish or something like that. That was a really bad case of hemorrhagic Ebola virus, and that's what this guy has. And yeah, so you will learn about that, or you probably have learned about that too. So yeah, NN is Ebola. OO. A teenage girl rushed to the hospital via ambulance. EMT found her with a high fever and blood pressure of 60/40 hypotension. She was currently, her blood pressure was 60/40, so low. She's currently menstruating, also undergone recent nasal surgery packings that were not yet removed. So, right there, nasal packings and menstruating. So, pretty much like the nasal packings are like cotton after your surgery. So, like, it's almost like the same thing that a tampon would be, just in your nose. And, not removing tampons can obviously cause toxic shock syndrome. And the same thing goes for like a packing in your nose. It's like the same kind of concept. It's in there in your nose. It's like this mucousy area, and we're back, and it's being exposed to your bloodstream. So if bacteria is exposed to your bloodstream, it'll get in, and then it'll replicate, and then you have toxic shock syndrome. So that history, coupled with the large body rash and peeling on the palms and the soles, all scream toxic shock. So PP. A 72-year-old man presents to his cardiologist with abnormal heartbeat, chest pains, fever, and several small but noticeable rashes. His history is recent for being fit with new dentures, which are irritating him, as well as recovering from a total hip replacement 6 months ago. So this one is going to be endocarditis. So like it's weird, but you like see people with like hip replacements and stuff like that, and like new dentures and stuff like that, present with like endocarditis. I don't know, for whatever. Sorry for that mess up. It was like too long of a video, so I had to like stop it and then start again. But yeah, so for whatever reason, like after like hip replacements and bone replacements, some people can present with endocarditis, and yeah. So PP, 72-year-old man, endocarditis. This one's QQ. A 38-year-old man is helping in the floodwaters of Hurricane Katrina, and develops an infection on his leg. He sustained an abrasion cut from debris, which began to fester and spread through his calf at a rapid rate. So this is necrotizing fasciitis, and this is like a very, 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 very fast-spreading and serious disease. Could be caused by a lot of things like Staph aureus, Group A strep, but V. vulnificus and A. hydrophilia are like other common causes of this, and vulnificus, I believe, likes salt water, and this could be a possible cause. But yeah, this is neck fash, spreading at an insane rate, and his dead tissue. So necrotizing means like it'll turn black and it will die. So yeah, necrotizing fasciitis, his abrasion that he got from cleaning up the water, and yeah, so QQ neck fasciitis. RR, this one you could do going to your lab materials and finding like the lab videos, but I'll give you the answers for this one. Number 12 in RR is Lyme disease. 13 is toxic shock. 14 is tularemia, and 15 is Lyme's disease again. So the last four. So SS says identify the likely organisms responsible for the outbreak. This is septicemia, most likely caused by Pseudomonas aeruginosa, or Staph aureus is also possible. TT says, how would you react to the doctor's statements about not being a palm reader for these kind of infections? Well, you should be like, well, there was a lot of opportunities for this to happen. It's wet. There was a hospital. There were many people in contact, newborns. It was immunocompromised. So, like, there's a lot of reasons that this infection could have happened. So, he's the director of infection control and didn't know that. Fear goes like, no way. He's the director of director of infection control and he didn't know this. SMH. So yeah, there's a lot of things that could point to this kind of infection. It's like no shock that this person got it. So UU lists some virulence factors of the possible organisms that you diagnose. So I mean, I know for aureus, Staph aureus, and Pseudomonas, they both have toxins. LPS is a virulence factor, and then some antibiotic resistances are also virulence factors. And how will you manage and treat systemic diseases in your futures? Knowing the differences in like the signs of septicemia, bacteremia, and all that stuff, like your low blood pressure, the high temperature and stuff like that. That's really important for diagnosing these diseases in the future. And I think that's it, like, for all of them. There's a bonus thing for another app. It's called Plague Inc., which we played last year in lab. It's pretty fun, but it's like more of like a in-lab thing it's better for. So it's 99 cents in the App Store, but you can play it if you want for extra credit. I think that's it. So I think I went through pretty much all the answers. You guys' exam is next week. I hope this is clear enough. If it wasn't, just ask me about any of the questions that you need help on or anything like that. And just ask me and I'll give you the answer and try to explain it better than I did in here if it wasn't clear enough. Email me your finished labs by Friday. And then we should be good. And that's like our last lab forever pretty much. So you guys made it through. And then between now and your exam, I'll probably hold a Zoom or something like that to go over some of this material with you guys. But yeah, that's it for this video. And yeah, we're done.